As the summers are setting in the nephro OPD, there will be a drastic increase in the number of kidney stone disease patients or renal stone. This trend is observed every year. Already in the country, summers set in. So we thought of bringing awareness video on kidney stones. In this, the first episode is regarding the common clinical presentation or symptoms of kidney stones or renal stone, also called as nephrolithiasis. First, why in summer? In summer, the dehydration is more. If the person didn't take adequate hydration, that is water, the urine became concentrated, and the concentrated urine forms the milieu for urinary precipitation, thereby worsening of the kidney stones. So this is a short summary why in summer. Coming to the common presentation. First, flank pain, especially on the back between the ribs and the pelvic bone. There will be pain. Pain is episodic and might be very severe. The location of the pain varies with the location of the stone. The stone can be in the kidney or in the pelvic calcium system or in the ureter or in the bladder. Usually in the kidney, whatever the size may be, unless it stretches the kidney capsule or it is obstructing the urinary flow, the pain is bit rare. The pain is more common as the patient's urinary tract pathway is being blocked by the stones. The radiation can be to the inner surface of the thigh, suprapubic region, and depends on the location of the stone, the radiation might vary. So the first and the foremost symptom might be flank pain. It will be as severe as a knife being stabbed into the flank area. Yes, that much severe it can be. It might be episodic. Excruciating pain occurs at a periodic time and again resolve. This occur over a period of days, again and again repeating. The pain will come for a short span and resolve, and again short span and resolve. If the urinary tract is obstructed, the pain can be for a longer duration. First. Second one, hematuria or presence of blood in the urine. This is also another common presentation. Third, urgency or any lower urinary tract symptoms. Even a burning micturition patient might be having. If the urine is getting infected, secondary to kidney stones, or if those two conditions coincide, because a concentrated urine might act as a precipitating factor for both, the patient might develop lower urinary tract symptoms, especially urgency or burning micturition. Next one, passage of granules, or sometimes patients say, sir, during urination I have passed the stones. These are the granules. Like that, the symptoms can be there. If the number of stone is more, the patient might say, I have passed the stones. Next one, fever with chills and rigor can come if there is a urinary tract infection along with these renal stones. If the urinary tract pathway is obstructed, there is a high chances of secondary infection. The patient might develop fever with the chills and rigor. And one more symptom in the OPD we always ask is whether the pain is associated with the nausea and vomiting or not. Why nausea? Because nausea and vomiting are GI symptoms. Why in kidney stone disease? Whenever there is a urinary tract pathway obstruction, there will be stretching of the renal capsule secondary to the hydronephrosis. In simple terms, I have to put the urinary tract path, kidney is swelling up. Whenever there is a swelling of the kidney, there will be a stretching of the capsule. Since the GI tract, almost the nerve which is supplying the GI tract having some supply over the capsule, so the patient might develop nausea and vomiting. Sometimes the kidney stones might be asymptomatic. Asymptomatic kidney stones will do harm. Suppose if the urine hydration is taken care of, usually it resolves sooner or later. So the common presentations are, as I told, it's a pain, hematuria, lower urinary tract symptoms, burning micturition or urgency, passage of granules, and sometimes fever with chills and rigor, and nausea and vomiting. These are the common presentations of a patient presenting with kidney stones. In the next episode, we are going to see which is the investigation to select in cases of kidney stones. Bye bye.